Hi everybody, and welcome to Chapter 4, Therapeutic Communication. In this presentation, we're only going to be focusing on pages 40 through 49. 40 through 49 will be the focus of this presentation. At the beginning of the chapter, always be sure to look at your learning objectives, and it gives you an idea of what the chapter is about. And if you see anything that you are not familiar with, then that's an area of the chapter that you want to pay a little bit more attention to so that you can understand the concept that is being presented to you in the book. So one of the first topics is first impressions, and I know most of you have probably heard the slogan, first impressions are everything, especially when we go on things like a job interview, or maybe we're looking for a new outfit, and then we go into the store and we see the outfit and we go, nope, not getting it. A new pair of shoes, anything. First impressions are everything. And so especially in the medical office, you are probably going to be one of the first points of contact for that patient. And not just the patient, but in the morning and in the evening, you and the physician and the nurses and the other clinical staff will also work together throughout the day. And so, you don't want to be the person who makes a bad first impression. And so part of that first impression starts with your physical dress and appearance. The office should tell you, or at least your supervisor should tell you upon hiring, what the dress code is. A lot of times for the medical assistants, whether you're clinical or administrative, it is scrubs. But of course, we want the scrubs to be clean. You should not have a bunch of food or dirt on the scrubs. They should be ironed. You don't want, again, to come across as if you just threw something on in the morning and came to work. Of course, your hair should be neat. And then whatever else the doctor's office requires. So, for example, when I worked in the hospital, we could not wear open-toed shoes. If we had tattoos that were visible, they did request that, we covered them up. Our nails could only be a certain length, especially if you worked around patients. So these are all things that, you will want to consider, before you go into the doctor's office and when you're applying for the job. And sometimes they will have the dress code on the job posting. Having a positive attitude. So you're going to be dealing with patients throughout the day, not only patients, but internal and external guests. And, when we have a positive attitude and think positive thoughts, that tends to come across in our actions throughout the day. That does not mean that we don't have personal issues. Everybody has personal issues, but we should not bring them to work. We're dealing with, I always say that when people come to the doctor's office, they're coming because something's wrong, they're sick, or they're coming to, get the results of a test that may not be so good. So, we have to remain neutral, so to speak, in our attitude. But at the same time, you have to be able to show compassion, when that time comes for you to have to show compassion. And part of that is, you want to focus on delivering quality patient care. Quality patient care. That should be a primary goal for you. Be aware of the personal life of a patient, especially if it's a patient that you know and they come there quite often, or you just kind of built a little relationship with. A lot of times we can kind of tell if somebody's having a good day, a bad day, or if something has just immediately happened. So, when we start to build those relationships with our patients, it does show that we care and they want to come back to that office because, hey, I know that, he or she knows me. I know that they're going to do right by me. We know that personal life events, directly affect health, and that's also for you all as students. When you're under a lot of stress, that's going to affect your performance in class, at work, at home. So you have to be, be aware of where you are as you're working throughout the day. Always smile, always smile, whether you're on the phone or in person. There's nothing, more heartwarming than, approaching a person and you see that they're already smiling. So, whatever it is, they're going to help you, figure out what's wrong and how we can fix, whatever issues going on. Just be aware of, the surroundings, your interactions with staff. You just want to make sure that, as you're going throughout the day, you're communicating effectively. If you're angry or something just happened at home and you got a bad phone call, maybe from, the school of your kid or anything, that can immediately change your mood. But unfortunately at work, we have to be able to put those issues or resolve those issues rather quickly so that our attitudes do not spill over into our work. Again, first impressions are everything. As a healthcare worker, we're providing a service. We can't go to the grocery store and pick this off the shelf. We're providing a service that requires that we interact with somebody. So you just want to make sure that, when that time comes for you to give your first impression, especially to the patient, that it's a good one. Patient-centered care. Patient-centered care. Healthcare professionals have embraced patient-centered care, and it really just means that we have a focus on our patients. We really do care about what's going on in their life. We want to make sure that we're providing the best type of care, and that requires a lot. Part of it involves planning. If you've ever heard plan of care, and typically if there's a plan of care, there are other clinicians that are involved in making sure that patient is attended to. The delivery, how are we delivering it? So this is more, again, for the clinical side, and then of course the evaluation of healthcare. And it's evaluated by all parties involved, and that second bullet there just talks about who all is involved in this quote-unquote care, this patient-centered care. So we have the clinical staff, we do have the administrative staff, and that includes you, the patient, of course, and then anybody else the patient wants to involve, which is typically close family members, but it could also be close friends that, the patient deems, needs to be there as things are panning out. That each patient has a unique set of needs. We've all been patients and we will all be patients again at some point. My issue may not be your issue, and that's fine. But as the healthcare worker, we have to be aware of that. We can't treat everybody the same. We cannot treat everybody the same because their need may not be the same. Good communication skills are vital. So this is not just verbal, this is written. So you may, during the course of your studies, have to do papers or emails or mock interviews, but also over the phone. This is also nonverbal. Who wants to walk up to a front desk and somebody's all slouched over, face is all scrunched up, or they're chewing that gum, or they're on their cell phone. All of that is part of, communication. And it's also listening is also a large part of communication, which we're going to get to in a little bit. Patient-centered care also applies to patients of all ages, in all ages. And of course, this can be done in any healthcare setting. All right, verbal and nonverbal communication. So verbal communication, that's using words and sounds. Typically, that's usually our face-to-face or over the phone. We hear a voice. Your nonverbal is the opposite. It's your body language, your gestures, your mannerisms, your eye contact, your facial expressions, your posture, your touch, etc. Why is it so important to be able to properly interpret nonverbal communication? Well, guess what? Our ability to help others increases as we can hone our own skills in interpreting nonverbal communication. It's almost always more accurate than verbal communication and tends to convey our true feelings and beliefs. So again, I always think of, again, when we come to the doctor's office, we're coming because something's wrong. Sometimes patients are not on their medications, so they're not themselves. Sometimes they've taken too much medication. Sometimes they are just so sick, they just can't, it's just, painful for you to watch, but also, they have a hard time communicating verbally. So you have to be able to watch, their expressions, but also you have to watch yours as well. And sometimes our gut feeling is right. Just like I said, a lot of times we can kind of gauge the nonverbal quicker than the verbal. Because somebody can always say, oh, there's nothing wrong, but you look at them the next minute and they're crying, So all of these things matter as you are going through practicing your communication. Verbal communication, of course, that's oral and written. That's one reason why you have to double check. Anytime you write anything, you should always be looking for your grammar mistakes, any spelling errors, because you don't want to be the person that has the horrible email every time and, oh my gosh, I don't want to read anything else from her. You want to watch your tone of voice, your pitch. If I'm saying, hey, your work's late, obviously I'm angry versus, hey, Jane, your work's a little bit late, please, get it in by 5. That sounds a little bit more accepting than, you know what, Jane, your work is late again today. So you have to watch your tone of voice, especially as you're interacting with your coworkers. Again, everybody doesn't have a good day. And we're with our patients and our coworkers more than we're with our own family sometimes. So, it's an 8-hour day. Sometimes it's a 10-hour day. So you're with these people, quite a bit, and they are your work family. So, I want to have a good relationship with my work family. You watch your word choice. You know who you can kind of joke around with and who you can't. So if it's a person that you can't, be very careful what you say. Be careful with the words that you choose. Watch your gestures, okay? And no matter what, patients always expect professionalism. Okay, never forget that. And we've always had there's always that funny patient, because they want to make us laugh too. But just be careful. Be very, very careful. Eye contact is huge in our country, but sometimes you will get patients from other countries where eye contact can be considered, rude or demeaning. So you may want to read up on what cultures, are not, do not highly regard that eye contact. When you talk to somebody, make sure you're clear. Don't mumble or be really, really low. Because then patients are like, what? What did you, I can't hear you. And then all of a sudden you've got that tension with the patient. So be sure that you speak very clearly when you're talking. What are some examples of forms of written verbal communication in healthcare? Well, those are our pamphlets, our newsletters, our handouts, any orders from the provider, emails, faxes, text messages, and any handwritten notes. Electronic communication is efficient, but used with caution. One thing that you have to be careful of is writing something in all caps. That is considered you are yelling at me, and actually you're being disrespectful. Now, sometimes when text messaging your friends, maybe that's how you all do, but that is not professional type of communication when you're putting it in all caps. That also, that can, make you look bad. So, always use the appropriate grammar and punctuation when you're typing your any written communication. Remember patient confidentiality. When we're doing certain forms of communication, you have to be very careful that you are following HIPAA law. So be sure again that you are making sure that you are not exposing any type of patient confidentiality. You must ensure the patient is receiving the information if it has anything to do with, privacy. Do not use abbreviations in text messages, and I know that we do that. We call it text talk. We shorten things, but that again is not acceptable if you're trying to send something that's professional out via text message. Again, don't use all caps in text messages or emails. Definitely not the email. You're nonverbal. So again, that's mainly your body language, your gestures, your mannerisms, your appearance. If I was to come to work every day, my hair all over my head, I've got crust still in my eye, my clothes are tattered and wrinkled, you probably go, what the heck is going on with her? And you would have a rightful thought there. And because you should not come into, again, your place of work and you are not together, especially when you're going to be working around these patients. Watch your facial expressions. How many of you guys have, been talking to someone or talking to your child and you knew immediately either they were angry or they were not, telling the truth, or, they were upset or something. So you have to just, watch your facial expressions. If something happens at work and you need to take what I would call a breather or a timeout, then do so. Tell the appropriate person and, take, 5 minutes or however long that you've discussed. But don't, take your moods out on, your patients or your coworkers. Self-esteem and confidence, of course, someone with not even high self-esteem, but just good self-esteem. You're gonna want to do a better job than someone who has low self-esteem. So watch your self-esteem and confidence, because that can also spill over into, your patient care. Even on the phone, if you've ever talked to someone and they're, good morning. All right. Well, we'll see you when you get here. Unless it's a medical condition, that to me says, I don't want to be at work, So don't be that person who always comes across as, there's something wrong, maybe they don't have the confidence to do the job. No one should get you down to the point where you don't have the confidence to do the job. If you've gone through the hiring process and you've landed that job, then you have a right to be there at that job and do it well. Be sure you look at Exhibit 4.1 in your book. This gives you some tips on how to respond to different types of nonverbal communication. All right, so this is our table I just spoke about, Table 4.1. I hope you can see it there, but again, it is in your book. So if you observed, one area to observe is breathing patterns. If they have rapid respiration, sighing, shallow thoracic breathing, that could be anxiety, could be boredom, could be pain. But notice how that's kind of like at every end of this, those are 3 different things. So, you really have to pay attention there. And if you can engage, that person in conversation, you may even be better off figuring out which one it is. Eye patterns, if you observe, side to side eye movements, looking down at their hands, that could be a sign of anxiety, distrust, and even embarrassment. Again, those are three totally different things. The hands, tapping fingers, cracking knuckles, continuous movement, sweaty palms, again, could be anxiety, worry, or fear. Three different things. Arm placement, folded arms across the chest, wrapped around the abdomen. It could be anxiety, worry, fear, or pain. Now, in the past, we used to think folded arms mean you were just uninterested, but I fold my arms all the time, and it's because I'm cold. It has nothing to do with it. I'm uninterested, but again, try to engage that person in conversation to really see what's going on. And then lastly is leg placement. If it's tension, crossed and or tucked under, tapping foot, continuous movement, could be frustration, could be anxiety, could be anger. Person could actually be high. Hate to say that, but that is definitely continuous movement with the feet. That the person could actually be high. So, be sure, again, these are just different things to look for. You will not know what's going on unless you can engage that person in conversation just to kind of get a good idea of what's going on. All right, recognizing and responding to verbal and nonverbal communications. Again, eye contact is crucial. And typically we do in our culture in the U.S. here, we do typically we expect eye contact of some sort. You always want to look for signs of trouble. Crying, a person could be crying because they're happy, and then again, a person could be crying because they're sad. So you have to look for what is the underlying issue. Reassure patients of safety. Again, we do not allow emotionally unstable patients to be left alone. That is not good, and for a number of reasons. And that's one reason why, if you feel like, if you're at that front desk and you are seeing a patient or patients exhibiting some abnormal behavior, observe, and if you feel like it's an issue that you can handle, and that is part of your job, then you definitely want to figure out what the heck is going on. But again, someone who's emotionally unstable, we don't want to leave alone, and sometimes it's even best to kind of get them out of the waiting area, away from the other patients. Because I don't know if you've ever been anywhere and someone's panicking, and all of a sudden everybody's panicking because of the event. So be aware of that. Be aware of abnormal behaviors. Observations must not be mistaken for diagnoses. Very, very important statement. Just because, you see me acting as if I'm, high off of something, that does not mean for anything that I am going to overdose or that I'm on, a certain drug. Again, sometimes it could be because I didn't get medication. I didn't get the proper medication, or, maybe I took too much, accidentally. So again, most of us, especially on the administrative side, are not clinicians, so please do not diagnose. If it's something that you can't handle, be sure that you get someone for help. Communication barriers. So, of course, sometimes, barriers do exist when we're trying to communicate with a patient or with our coworker or with our supervisor. They just do. But effective communication requires the delivery of a clear message to the patient. And sometimes that means you will have to meet the patient where they are. And that, is something that you would have to figure out, or along with either the nurse or the doctor. Communication barriers can arise from both medical assistants and patients. So again, we could be the issue. So we could be the issue. So here are some things that you can do or even say when you're communicating with the patient. So providing unwanted assurance, instead use a reflective response. So one example is, you know, you don't smoke, do you? So that would not be the correct way to state that. It would be more, you want to be more politically correct, number one. But how about, have you ever smoked? Or do you use tobacco? You know, versus, you don't smoke, do you? Although I can tell you that that does happen. That does happen. The wrong way, it happens quite a bit. Giving advice. Encourage further discussion with the provider. Again, we're not clinical, and it doesn't matter if you're going to be a clinical MA or not. You cannot make a final diagnosis. So you do not want to put yourself in a situation where you have told a patient something and it is not true, or you had no legal position to do so. Using medical terminology. So we can talk medical terminology amongst each other, but will a patient understand some of the stuff we say? Absolutely not. So you're going to have to adjust your vocabulary to fit their vocabulary to where they understand what you're talking about. Leading questions, which again, we could use the, you don't smoke, do you? You don't drink, do you? Those things, again, can look like I am putting you down. I disapprove of you. And that's not what we want to do. I'm talking too much. If you're talking more than the patient, then you're not being a good communicator. You need to talk less and listen more. Stereotyping, preconceiving something, and guess what? It doesn't apply to the patient. We have to be very careful with this, putting patients in buckets or things or categories when in fact it would not even apply to that patient. Physical impairment. So you may have to adjust the waiting area or the exam room if a person has a physical impairment. And you just do it as appropriate as you can do it. And sometimes if it's a patient that's been at the office before, you know exactly what to do. Sometimes the patient will tell you, hey, this is what I need, blah, 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 blah. We just have to accommodate that patient as best we can. Language. So we know, not everybody speaks English or good English. So if there's a person that, maybe speaks Spanish or, Portuguese or whatever it is, we just want to make sure that, if you don't understand the language well or can't speak their language, that we have somebody there that can, because those patients also deserve, good communication, even if we don't speak their, language. But by being sensitive to problems, as the medical assistant, you can use different types of, these types of techniques to help your patients. And again, it's just showing that you care, sensitivity to diversity, especially if you're an office that has a wide range of diverse patients. Empathy is key to creating a caring therapeutic environment. Again, you're trying to build a relationship with your patient, whether it's just checking them in and maybe that's all you see them when they check in or check out. But you must, give quote unquote care to each patient. Many different factors influence the development of a value system. They begin as learned beliefs and behaviors. Families and cultural influences shape the way we respond to a diverse society. So, again, this is just being sensitive to different backgrounds, different types of people, different types of neighborhoods, because everybody is influenced by that, whether, you grew up in the country or you grew up in the city. That is a part of you. So that's going to be a part of your patients when they come in. And you have to be, sensitive to, what they believe, their behavior. Doesn't mean you have to agree, but, they are a customer. And that's one thing I haven't said. Our patients are our customers. And just like you as a patient can go anywhere you want, so can they. Overcoming barriers to communication. Treat every person as an individual. As an individual. And that doesn't mean we'll have the same issues. Again, all of your patients are unique. But treat them as an individual, and once you understand, what they're dealing with, I think that you can start to get that relationship building going. With your non-English speaking patients, you may need to use gestures and more body language to, get your messages across. Always discuss calmly. Respect other people's opinions. You do not have to agree with what I believe in, and I don't have to agree with what you believe in. But at the end of the day, I want you to know that I'm going to respect you. And I think, once you get that, that person sees, oh, well, she's very respectful, you're able to still have that relationship, that medical assistant and patient relationship or coworker relationship. Communication during difficult times. Communication, of course, everybody's not a good communicator. I think we all know this. So you have to keep that in mind, because difficult times are going to arise in the office, whether it's with a coworker or other staff, or whether it's with a patient. Always remain calm. Always remain calm. The medical office itself is just a sensitive area anyway. Remember, patience is important. Things happen, and sometimes we can't resolve them immediately. It doesn't mean that, the issue is not important. It doesn't mean that the patient's not important. Just sometimes it takes other parties or other elements to get things resolved. Determine the best way to help the patient out if they're in any immediate danger. Again, if you've got to call 911, if you've got to call, the doctor, you got to figure out, okay, what's going on here, and make sure that, everybody's safe, especially your patient. And of course, listening. All right, so in the book, you have what's called the linear communication model, and it just basically describes communication as an interactive process, and it does. So it involves the sender, who is the originator of this message, the receiver, which could be you, and then any feedback, which could initially come from the receiver and then back from the sender. The verbal messages that you send are only part of the communication process. That's if you have to send any verbal messages, especially if you are expecting some feedback. And then if we're asking or communicating with the patient, more than likely we are waiting for the patient to give us their important feedback. All right, this is the last slide for this week. But active listening. So again, if you are talking more than you are listening, you're not being a good communicator. You need to be listening more than you are talking. So hearing, that is the actual process or function and the power of perceiving sound. And listening is actually paying attention to those sounds, or what is going on, or the conversation. You're actually hearing something, you're processing it, etc. And then the three processes involved reflection, restatement, and clarification. And this is if you're really paying attention, then you should be doing the three processes at the bottom there. Active listening goes beyond hearing the patient's message. It goes to concentrating, understanding, and really listening to the main points of the discussion. If you are really listening, then you're not in a passive role. It doesn't mean you're just listening and you don't get an opinion to state. It just means that you're listening to what that person has to say. And again, you're concentrating, understanding, and just processing what's going on. And then when you get a second, we'll probably come back to this, but take a look at table 4.2, and it just shows you how to apply the feedback techniques. So reflection, restatement, and clarification to obtain the patient information. Now, I know we're focusing on the patient, but you can use these same techniques with your coworkers. So again, I've gone over my 30-minute mark, but this is the longest presentation for the course. So please be sure that you really take a look in your reading. Please read your chapter so that you can understand what the chapter and the PowerPoint and what objectives are really being stated to you in the chapter. And that way you can have an excellent and productive week as you complete your discussion and your assignments. Thank you, and I will talk to you soon.